To have a good experience with a total knee surgery, it's important to be prepared. One of the things that we need to be prepared for is management of swelling. Swelling is going to occur with any surgery, especially with the total knee surgery, and being able to control swelling is going to be very helpful and key to a quick recovery. I was very lucky to meet Mrs. Austin. I met her through management of her husband, who had a total knee and had one of the quickest recoveries I've ever seen in my 30-year career. He had lymph system treatment ahead of surgery and had it after surgery, and I'm sure that Mrs. Austin had a tight schedule and kept things moving like it should, and it really made a difference. So I'm encouraged that if you follow Ms. Austin's recommendation, if you're treating your lymph system ahead of time so that the collection of this fluid is optimized, and if you pursue the treatment throughout the recovery process, I'm confident that it will help decrease the amount of swelling and improve your outcome.
Hi, my name is Gisela Austin. I'm a licensed massage therapist and I'm a certified manual lymph drainage therapist. Today we are showing you the lymph flow stimulation technique, which, unlike massage for muscles, is very, very gentle. If you are the caregiver, please follow these few steps. Before the surgery and post-surgery, do the treatment 2 times daily for 10 to 15 minutes at a time. Wash your hands and dry them before performing the technique. It's also good to have baby powder handy in case you need it throughout the treatment. The pressure needed is very lightly, only to stimulate the lymph vessels in the skin. Now I'm going to demonstrate you the 2 strokes to stimulate the lymph flow in the skin. And make sure the patient is laying comfortably on the back, and also that skin is exposed, so you do the stroke directly on the skin. Okay? The first stroke is the relaxation stroke, which is very important. You put your hand flat on the skin and leave it like that, and then you pull towards the direction we show in the picture. And you do the techniques 10 times each, and very gently and very slow. Gently because you only treat the skin. That is the relaxation stroke. This next stroke is the pulling stroke, and you put the hand flat on the skin, and then watch how I pull my fingertips down, not poking, just pulling them down like you get a grip on the skin, and then you leave the hand like this and pull slowly towards the chest. See that? Then you let go, then you put the hand back down there, and bend your fingers and pull. That will stimulate the lymph vessels. And then you very gently let go. All right? Now I'm going to show you the protocol of the before surgery treatment. Okay. And I'm using the strokes I have shown you before. And you start 10 days before the surgery, 2 times a day, about 10 to 15 minutes. All right? You start at the neck. We're going to use the relaxing stroke. As you can see, have your fingers at your hand very flat and very gentle. That is important. Very important. And you do one side at a time, and then you do the next side. Flat hands or flat fingers, depends on the neck, and very gentle just to the skin. If you have a short neck, you probably are better using just 2 fingers. And if you have a longer neck, you use all the fingers you can, stroke down, because you want to have contact to the skin. That is important, but not pushing deep. Keep it gentle. All right? So that was the beginning of the protocol. Now the next step is the abdominal area, because all the lymph fluid from the legs goes through the abdominal area. So you start with next to the umbilical, one hand at a time, so it's not confusing, and you put your hand down very gentle and flat, and you pull following the diagram. All right? This is also, as you can see, the relaxing stroke. And we start with that, and I will point out which stroke I'm using. And you do one side at a time. And also, I like to have the second hand on the patient. If you cannot do that, you need to lean on, you can do that for yourself, but you need to make sure that your hand is flat on the patient. See how it starts getting moving like this? That is the point where the powder will come to pass, because sometimes we perspire a little bit out of whatever reason. And I like baby powder because it's the safest out there so far. Try to get it non-perfumed and use a little bit of baby powder, not on the skin on the patient, but pour it into your hand. Probably a little bit like this will be good enough. And then rub your hands so they are smooth again. And then see how it does. And there you go, how nice and smoothly it pulls. Alright? And at the same area, you also can use the pulling stroke. Alright. No, did I have that? See how I put the hand flat on the skin, bend the fingers like I demonstrated, and then I pull. And you do that 10 times each stroke, always again. You put here, pulling stroke, or if you have to lean on because you are not able to do it without it, pull, put your hand flat, and pull. And then you do that 10 times. Then follow the diagram. The next will be a little bit outside, a little bit further, and then you start with the relaxing stroke again. Alright? 10 times. I'll just do a couple times. The relaxing stroke. Then you go to the other side with the relaxing stroke. And you put your hand flat and just do it. And then you go pulling stroke. And 10 times. And the third stroke is on the side of, and you start at the hip bone and you pull the relaxing stroke.